Focus is brought to you by National Medical Stores, NMS, passionate about your life.
In April this year, the World Health Organization established the COVID-19 Tools Accelerator to develop vaccines, diagnostics, and therapeutics with the goal to have them allocated fairly. And according to the Director General, Dr. Tedros Adhanom, this has yielded positive results.
We have reached agreement for the purchase of 120 million low-cost rapid diagnostic tests for low and middle-income countries. We have secured supplies of dexamethasone, the only medicine shown to reduce the risk of death from COVID-19 for up to 4.5 million patients in lower-income countries. And as part of the ACT Accelerator, 189 countries and economies are participating in the COVAX facility. But unless the ACT Accelerator is fully funded, it is in danger of becoming no more than a noble gesture. The ACT Accelerator faces an immediate funding gap of $4.3 billion to lay the groundwork for the mass procurement and delivery of vaccines, diagnostics, and therapeutics. A further $23.9 billion will be needed next year.
Many countries were caught off guard after the outbreak of the pandemic. Dr. Tedros says investment for health catastrophe preparedness should be prioritized.
Many of the countries that have done best are those with recent experience of responding to outbreaks of SARS, MERS, H1N1, and other infectious diseases. Now all countries must develop that same muscle memory and invest in the measures that will predict, prevent, control, and mitigate the next crisis. It's also clear that the global system for preparedness needs attention. The international health regulations is a powerful legal tool, but countries must use it more effectively. It's clear that the IHR can only be successful if it's based on mutual trust, mutual accountability, mutual transparency, and robust political legitimacy.
Dr. Tedros says this situation now serves as an example as to why meeting the global health targets is key. He adds that political commitment is also important.
The pandemic has only underlined why universal health coverage is so important. In the face of the pandemic, many countries have offered free testing and treatment for COVID-19 and have promised free vaccination for their populations. They have recognized that the ability to pay should not be the difference between sickness and health, between life and death.
This should come along with investment in vaccines.
But too many countries have neglected investments in basic public health functions that need very small, low investment, but which are the bedrock of safe and healthy nations. In particular, strong primary health care is the eyes and ears of every health system and is essential for preventing and responding to emergencies of all kinds, from the personal crisis of a heart attack to an outbreak of a new deadly virus like this one. If the world is to avoid another crisis on this scale, investments in basic public health functions, and especially primary health care, are essential. And all roads should lead to universal health coverage with a strong foundation of primary health care.
Despite the fact that some vaccines have shown positive results, many nations, especially in Africa, are now pondering the question of equitable distribution. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store, and distribute essential medicine and medical supplies to all government health facilities in Uganda.